Shit. Hey, okay. Good morning and welcome to the 100 Families April Alliance meeting. Give yourself a hand for me. Yay! This is an alliance meeting for the community, by the community. Restore Hope has, what we do is we provide a space for agencies and providers that are actually doing work in the community to come together, collaborate, and to connect to help families move from crisis to career. Very quickly, I'm going to go over the agenda for today. We provide a case management system that allows all of you that are providing the service for families in Pulaski County to communicate. On that platform, you're communicating with one another, and there is truly collective impact and data that proves that when we work together, everything becomes more collaborative, it's efficient, it's effective. And Deanna is going to show us that in a minute, how your work collaboratively and collectively have helped families move from crisis to career. Actually, stability all the way up to career. So today, we actually have some objectives that we are going to meet. Our objectives today is to understand, number one, the impact of reentry and recovery. Thank you, Pastor Bell, my pastor, Deborah Bell, who is also the director here at the Empowerment Center, BCD Empowerment Center. Thank you for hosting and allowing us to have our meeting here. If you are an agency and want to host a meeting, I see Goodwill. We had our meeting at your space last month. But if you would like to host an alliance meeting, let me know, and we can get that set up for the following months, okay? Thank you guys so much. But we're going to understand the impact of reentry and recovery, and we're going to explore how these services play a crucial role in stabilizing families and strengthening our communities. Number two, we're going to leverage data for better outcomes. So we're going to learn how Hopehub facilitates the collaboration and tracks family progress and enhances service delivery. We're going to strengthen community partnerships. This right here strengthens partnerships at our alliance meetings because you can network, you can speak with one another. You're going to identify ways that organizations work together more effectively to address barriers and to provide comprehensive support. We're also going to encourage active participation, and I'm going to speak more on that at the end. But we're going to inform you guys about 3 ways that you can engage with the Alliance, and that's via connection provider, point of contact provider, or stakeholder. And we're going to encourage you to join a committee. Yes, we're going to encourage you to join something else. So if your plate isn't full, or if it is full, we're going to add something else to it. We're going to promote training opportunities, which will ensure partners are equipped with the knowledge and tools to effectively utilize Hopehub and improve service coordination. And some of you, they're like, I know you've asked, what is Shauna doing and why is she bothering me? Number one, because that's a job that pays me. And if I wasn't doing that, my executive director right here, Paul Chapman, he would be trying to find me something else to do or letting me go. So that's my role. My role is to get you all on this collaborative case management system or to come to the alliance meetings. And no, I'm not trying to steal your clients. That was said too, that I'm stealing clients. How? That's not what this is about. There are so many families, so many people that need providers that you all are doing the work. You're doing the work. We're just providing a way for you all to communicate. That's it, via Hopehub. Okay? So, without further ado, Deanna, could you please come up and show us how Hopehub is used for the collaboration and give us some key data insights on family stability and show how partners can leverage the data to improve their client success.
Absolutely. Good morning, everyone. This is my favorite day of the entire month, is to get to have you all in one room and get to have these amazing events that we all get to network together. So because our meeting today acknowledges the intersection of recovery and reentry. There's a little bit of data that I thought would be beneficial that I might have stole from Paul Chapman. Thanks, Paul. In that we acknowledge that the state of Arkansas has some of the fastest growth in prison population and the highest percentage of children whose parents are incarcerated, which we have the opportunity to see every day with our families. And so, as Shauna mentioned, is we work in a collective impact model. We are not here to, again, we are not here to take on clients. We're here to share families. And so, and we do that together by connecting as an alliance for the community, by the community. So truly our whole goal as 100 Families Initiative is to move into the community and bring the people and the workers and the organizations that are already here doing amazing things and getting to bring them all together as we serve a family collectively who's in crisis. Or here recently, we even had attorney call, says, hey, my client's in Wrightsville, gets out in 3 months, has a foster care case, wants his children to come home. Can you come into the jail first and start working with him so that when he comes out, he's ready? And so that's a space that we have greatly enjoyed getting to come together. For those of you in reentry, for those of you who have families that have been broken up, like how can we put those together? And so as a community, we come all together in one mission and goal, and that is for Pulaski County and for 100 Families Initiative is to help a family in crisis reach stability and move on to thriving career, education. We want to change the chains of poverty that very often affect our families. And so how do we do that? We come together with a common agenda. We're all here for a common agenda of serving those families, getting more information regarding what's available in our community for reentry, for recovery. And the beauty is I see people in this room that I get to work with every day to serve families. One phone call away and a family gets recovery services by noon that day. It's a beautiful thing while we continue to help working together with our schools, with the schools, with family members, etc., to help that family. And so you guys are the alliance. I mean, this is what we came here to do, is genuinely come together. Right now, as a collective, I believe it's 1,314 organizations and statewide in our alliance. Take a one or two, I may be off a little bit. And 1,700 providers, there's a little bit more than that, working together statewide. And so that's the beauty. Here in Pulaski County, we have a little over 400 organizations working together and 377 providers that we're able in Hopehub to interact and communicate with back and forth. And so as 100 families, we are currently in 19 counties in Arkansas, as well as, help me out here, Paul, Michigan, and
Grand Prairie, Canada,
soon
to be Iowa and Louisiana.
Yes, and so at this moment in time, I was racing out the door this morning, and I was like, wait, I need the new map. I need today's map. And so as of this morning, we are currently serving 1,713 families together as alliances throughout the state. And so now I'm going to show you what that looks like live. This is that. There you go. See it, okay? This is the live version inside of Hopehub, which is our holistic case management system. And you two, as participants and organizations, are also able to access much of the data based on every care team that you're added to, everything that your organization is doing to serve alongside families. As a whole state, you can see the collective impact that does. Can you guys see that okay? Mm-hmm. It's okay. I want to make sure it wasn't too small. You can see all 13 of our areas down at the bottom there that include financial stability and housing and employment, food, mental health, physical health, child care, dental, physical health, transportation, recovery, safety, legal, and education. I like to add a 14th, which is other, which allows us to make every single family we serve an individualized plan. It's not that we don't take a cookie cutter approach, because sometimes what works for one family doesn't work for another. And so our advocates and our community are able to work together to build what works for that family. And then my favorite, I'm a little partial, is Pulaski County. Woohoo! Currently, in the last year, we have served together in this room 542 families here in Pulaski. You have no idea. And so, in this past year, we have helped families. We have helped families in financial stability. I'm really proud of, let's face it, here in Pulaski County, we have a housing crisis. You know it, I know it, we all know it. Not enough landlords, not enough properties, not enough fill in the blank. But this time, a year ago, we were looking at about 39% of improvement. It's something, but it wasn't terrific. And so, the 55% that we see today has been just a phenomenal improvement. Getting to work with a variety of property owners and utilizing all the skills together. Sometimes it's income-based housing, sometimes it's a private landlord, sometimes in the ability to work across our state with other communities. I see Matthew in the back. You know, we are both collectively on the Catch, the Central Arkansas Homeless Coalition together, and are constantly looking for new spaces and places to plug our families in. And then our employment rate is 72%. 72% of all of our families have shown 72% improvement in employment. That means even for some, they might have lost this job, we help them find another job, you know, so we're collectively getting to work together. And as of this moment, even I can't see that number, we are at 82.94% of all of our families are currently employed, which is absolutely phenomenal. And so, and how do we collectively do this together? These are our care teams. So many of you have been part of care teams helping connect our families to resources. In fact, this represents all of you. And, you know, Wolf Street Foundation found you. School districts, insurance agents, let's see, maternal infant home visiting programs, our house, recovery programs, school districts. You're all right here, and this is the collective impact working together. Because what this represents is absolutely the work we get to do here. It's not an us, it's a we. Like this is the impact you guys are making in our families' lives by bringing together what you guys do best and coming together so that we can communicate.
Your referral source from DCFS is impressive.
That's
new.
That is correct. And so our referrals come from a variety of locations. Many times it's directly from you. Our current referral sources right now, we have in the last year received 119 families served from DCFS. The fun part for me is also our self-referrals, because that's a family that has come through, heard about us, heard you've mentioned our name, and we've come together to work together alongside. And as soon as you make that referral, and I know it comes from one of you, you're instantly added to that care team, so you can follow on well beyond just that. Hey, here's a referral. Go check them out. And so, and then also the community and other child welfare organizations, and also juvenile justice, our court system. We receive referrals from all over. And so, and the ability to show, just because we're talking recovery today, is all of our families have a monthly assessment that is done by our family advocates, that helps find out how they are at that snapshot in time from when they came in the door. That's our initial intake, and then how they're progressing. They're moving forward, maybe a step back somewhere, and how we are able to do that. How we are able to do that together. And every month we're also doing a new assessment so that we can check how they are every single month. So it's not a one-time great, here's some resources, see ya. It's ongoing monitoring and care for our families. And so as you can see, there's a marked percentage of reduction in recovery, increase in housing rates, etc. We already talked about employment, and I also want to show legally we are helping our families with the pile of failure to appears that may happen, getting their driver's license back, helping them with non-criminal and criminal cases alike together through our partners. And so, and it reminds me, one of my favorite times has been one of our clients, and they won't mind me sharing just a little, who walked in and has had legal trouble since they were 17 years old. Ended up in prison by 18. Walked into our office with 18 plus charges, most still open. And it's been a year and a half, a little over a year and a half now, and more than happy to say not only has he been able to resolve every one of the outstanding records, he's gone on to have probation reestablished and not revoked. He's faced prison time more times than I can count. However, he didn't give up and he just kept going, and today he has 0 unresolved issues. He, for the first time since he was a teenager, no one's looking for him. And it's the beautiful impact that we are able to do together. And it was as a collaborative effort. It was recovery, it was financial, it was employment, it was all of the things coming together to change the life of a family. And so thank you for all you do and all we get to do together. So this data is yours. Yeah, I'm getting it back up.
Okay. Again, give yourselves a hand because that was your work. Good data, that's your information, and I know know that was a lot, but let me break this down real quick, and then we're gonna go into our amazing panel discussion. Okay, so opportunities for engagement. You can become a connection provider. That means there's a collaborative 100 family support, but you support the client's need, you provide referrals, and you stay informed about available resources. That's the connection provider piece. You can be a point of contact provider, which means you can utilize the system, receive referrals, communicate client progress within the system, or stakeholders mean that you don't even have to use the system at any point or be added to a care team, but you engage in leadership discussions, policy development, all that strategic stuff above my pay grade, stakeholders. And then training opportunities, see me. If you want to hear more about it or be on the system on Hopehub, you will be offered training for point of contact or connection provider in the system. We do have flyers outside when you sign in. You just scan that QR code, fill out the information, it'll come to me and I'll set up time for training. And then committees. You can join a committee. We have 3. Point of contact committee, career committee, connection. Look at you. Okay, that's my tech person. So there it is. If you want to sign up for training, you can do that. Take your little phone, put the photo there, scan that QR code. Y'all know how it works. All right. A whole lot of stuff. If you don't understand all of it, just contact me. sbruce@restorehopear.org. sbruce@restorehopear.org. I know y'all won't remember. Anyway, let's get into our panel discussion. My phenomenal panelists. I'm going to ask to come up, please. First, we have Deborah Bell. She is director here at Better Community Development, and she's not here. Okay. Next,
She's in the hallway running
Kyle
something.
Brewer. There she is. Kyle Brewer with Landmark Recovery. Hey, Kyle, my friend. Shanika Fisher Jones. Shanika Jones. And Kevin Cleveland, Natural State Recovery. Let's give our panelists a hand. Thank you guys for joining us today. We're going to get into some discussion questions here that I have for you. And then if you all have any Q&A, we're going to get into that too. So, panelists, my first question. What are the biggest barriers to successful reentry and recovery in our community? Any one of you can jump in at any time because I know you all have answers. And what if it's the same answer? Now look. So Pastor, so Shanika wants to go first.
Okay, so coming home from prison, this is what this looks like. You know, a person comes home, most of them have been incarcerated since youth. 17, 18 years old, 20 years old, they get out 10 years later, and they're used to somebody telling them what to do. They don't have to apply for a job. It's assigned to them. You're working in field squad, you're working in laundry, you're working in the kitchen. They don't have to pay utilities, they don't have to pay bills. So when they come home, and it's a cultural shock to them, that they come home, they get out, they're excited about coming home, they all are, but you have to go see your parole officer within 24 to 48 hours. They get to the parole office tells them, okay, so you have to get a job. If you don't get a job, we're gonna bring you back. You're on a point system, you have to pay $35 a month. That's what that looks like. So they come and see different resources. 90% of them, a lot of them come and see us. We get them in the office, look at their backgrounds, to kind of see what we can do to help them. See if we can, what their charges are. How can we place you with the employment that best meets you? Use your jobs, when you were incarcerated, because you can't go out and look for a job. The last job you had was 10 years ago before you were incarcerated. You were not on the bunks twiddling your thumbs, you were working, so you use that to cover those gaps in employment. So, what the biggest barriers are employment, because a lot of them, if they have sex offenses, it's like pulling teeth to place them with jobs. It's hard to place sex offenders with jobs. Now, we do have a few partners that will place them, but it's hard. When those people get those jobs, they hold them because they know how hard it is to get employment with those type of offenses. Housing, when they look back at backgrounds and they see, they are a convicted felon, it's hard to place people with housing. And another thing, financial. You know, they can get a place, but then they may not make enough money, 2.5 times the amount of the rent or 3 times the amount of the rent to cover. So those are some of the biggest barriers. So that's why Dwight and I, my reentry coordinator, we get out, we network, and we make sure that when we get that person into the office, you know, that we can provide resources, because that's what they're looking for. A lot of them have burnt bridges. You know, they don't have family support. You know, so when you get somebody that come in the office and you help them and they say, Ms. Jones, I won't disappoint you, it's weight behind that, because they've disappointed so many people along the way, and they're used to the disappointment and letting people down. When they have one person that believes in them and gives them the opportunity for a second chance, they take advantage of it.
I think that you did hit it on the head. One of the only things that I think that to add is transportation.
Yep.
So clients a lot of times cannot get to these resources. So even when we come up with these resources, how can they get there? You know, who's gonna pick them up? You know, I know Natural State where we are, we do provide transportation. I know Landmark provides transportation to our facility. But how can they get to these jobs? How can they get to the places to apply for housing? So that is a major barrier. And pretty much that, and as far as educating the community to understand where these people are coming from. Looking at addiction as is more of a, not a behavior, but a disease. So a lot of times people say, well, why did you just don't stop? Just stop. Well, it's a disease. And a lot of people don't understand it's a disease and not just a behavior. So I think it needs to be more education in the community going on. Well.
Okay, I'm Pastor Deborah Bell. I want to thank you all for allowing us to host you here at Better Community Development Empowerment Center. Here in this facility, the program is the Hoover Treatment Center, okay? I have some people in the room who are actually clients of ours, because we felt that if anybody needed to be here talking about it, it should be the people who need the services. So I'm going to ask if you are a part of the Hoover Treatment Center, if you don't mind standing so that people might see who you are.
Awesome.
Thank you for that. There were some people who didn't feel comfortable standing, and we accept that. Because we want people to feel comfortable saying who they are and what they need. I'm going to say ditto, 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 ditto. But the first barrier is you got to get out. So that means you got to have an address. You got to have somebody who will accept you. So before you start talking about education and a job, you got to have an address. So we work directly with the courts and Pulaski County Jail. Have collaboration, connections, relationships are key if you're doing, I call this ministry.
All right.
Now for some people it's about a job. A job and a career pays you good money. But when you're doing ministry, you don't get paid much. So I'm a pastor, so I'm doing ministry. Hint, hint. I don't get paid much. But anyhow, I'm going to get mine in glory. But, I forgot what I was saying because I started reading. Help me, Jesus. Okay, but we partner with Pulaski County and the court system. So you got to have an address. So we have persons, if y'all know Reverend Dr. William H. Robinson Jr. Hopehub. He is retired now, fully retired. He would go into the county jail to begin the conversations, to begin the relationship with the person who was there to see if they are ready, number one, and to let them know that there are rules. You might not have followed the rules when you lived at home, but when you come here, you follow the rules. And we work directly with the courts. The best thing about that is that there is accountability. And that right over there, Hoover people. Accountability, which is key. And so we're fortunate enough to partner with other agencies. We provide the substance abuse treatment. so we can partner with others, the Detox, the 100 Families, the city, HUD. But the barrier will be, funds are being cut. I mean, we know, so we gotta talk about not only the barrier that was, but what will the barrier be now that we have an administration? I'm sorry if I'm you on the other side. I'm about helping people, I'm on that side. The one thing we do is believe in working with the least, the last, and the lost. Most of the people we get, nobody else will take them because they don't have insurance, they don't have their medication, they got mental health issues, they have all these other things to keep them from even leaving where they are. So again, you gotta have an address, in most cases, and some type of relationship and a program from our experience to work with. So that, I'm finished.
I'm Kyle Brewer, and I'm grateful to be here on this panel with these amazing organizations. And thank you to 100 Families and Restore Hope for all the work that y'all do across the state and all the communities. I would say that the biggest barrier to reentry and recovery, I believe one of them is the way that we look at it. Reentry, I would say that you start working on that towards the end of your time incarcerated, versus reentry should start the day that you go in, right? But our systems are designed to try to, it really restricts people's ability to stay connected to their loved ones, to the community on the outside without, they have to pay. Some people don't have the money to pay for call times or video times. And so the system's kind of not set up to make it easier for people to stay in connection, stay in relationship, and those types of things. And then they start working on a reentry plan like way down the road. And I think it would be helpful if we started working on reentry and recovery when someone's incarcerated, like from the moment that they entered into that space. So programming, case managers, et cetera, that could help folks with that. And then when you come into the community, and reentry and recovery are so connected because, I think it's between like 50 and 65% of people that are incarcerated have a substance use disorder, and like about 80% of them were under the influence of drugs or alcohol when they committed the crime that got them there. So in a lot of times the treatment or the recovery is like maybe the core issue that if you were to address that, treat that, the behaviors that lead to committing crimes may not happen. But when you come out and say you've committed a felony, and it doesn't matter how long ago it was, there's all kinds of discrimination in our society, but that is one form of legal discrimination that we allow, whether it restricts you from certain housing, it restricts you from getting certain jobs, it labels you for life. And there are ways to get pardons and et cetera. I know people that have gotten that, but that process is very difficult, and you really have to be a specific person with a lot of influence and relationships to be able to get it. So, you make a mistake at one point in time in your life, that mistake can follow you forever and make it really hard to do some of the things that could set you up to be successful and to, reintegrate. The last thing I would say is, what is successful reentry and recovery? I think we have to define that, because I don't think that that's a standard definition for every single person. That may look different for different people, depending on their circumstances.
That's good. All right. Next question.
Here's the hand up.
Oh, Lavelle.
Good morning.
Good morning.
Everybody. So I wanted to ask the question, are we going to be able to ask questions or have conversations through each segment, or do we need
At
to wait
the
to
end.
the end?
At the end. We have some questions to get through in the end. So if you have a question, if you are not going to remember it, kind of put it in your phone, and at the end we're going to ask the panel or just open up discussion questions. Thank you, sir. All right. Our next question. How can organizations, hence alliance meeting, how can we work together as organizations to create a smoother transition for returning citizens? And let me say this, and if you don't get it, or if this is your first time at an alliance meeting, if you don't get it now, you will get it if you continue to come to these alliance meetings. We don't just come to talk, we come to talk, discuss, and then go out and do the work collectively. Okay? All right. Alliance. So how can organizations work together? This is,
I want to go first all the time.
go ahead, Ken.
I think we have to look at each client from a holistic approach and understand what each person needs. Everybody's case is different, right? So continuum of care is the most important. I've been blessed to be able to work for organizations such as Natural State. My CEO is here, Ms. Dory Haddock, and she'll kind of explain that we have every level. So being able to have detox, residential, outpatient, and chem-free housing, we're able to cover a lot of those things. Not only that, we have pretty much everything as far as every type of counselor. So peer services, having each one of those different things out there for a client to utilize helps the success of the client. And I think that's the most important. You got to have a place where a client can go to be able to grasp all the things that they need to be successful.
Okay, I'm gonna say collaborating, educating, and networking. That's why discussions like this are very important, so you can know who's doing what. You know, if you have an organization you're working with, or you may not be able to provide the resources, but you may send them somewhere else that may be able to provide the resources, or partner with someone that's able to provide the necessary resources. You know, you have to collaborate, you have to network, you have to educate. You just have to do it. It's no such thing as I and team. It's just not. And if we have to work together to ensure that someone's reentry journey is successful, and that's just what we have to do.
And guess what? We have a system that allows that. It's called Hopehub. And no, we're not stealing clients. We are collaborating, and we are actually opening up the door for everyone to see what resources are in the community. And then you're talking. You're not just referring here and here. You're actually communicating about the needs of the family that you're serving. Anyway, I digress. Pastor Bell.
Okay, how can organizations work together? In order to work together, we have to know each other.
Yes.
We have to truly build a relationship and have trust.
Yes.
I mean, I have no problem with you stealing a client, if that's what you call it. Because I'm
Word on the
a
street.
some
That's the
more.
word on the street.
There are plenty of clients, people who need
Thank
services.
you.
So I do believe that I'm on this panel today because of her. We know each other. We have a relationship. We trust. Even if I'm not at an alliance meeting, we are connecting. So collaboration is a big old word that the government started using. I said we connect. We got a relationship. And the more we can do that, the easier it will be for our clients. So there is no way that you can do this work if anybody thinks they can by themselves. That is not, because there are too many needs. We know what we do well.
Yes.
And we're going to do what we do well. And whatever you do well, we want them to go to you.
There you go.
Because we don't have enough staff and they cutting the dollars. I'm going to keep going on that. Y'all don't hear me say nothing else. I want us to come together how we can go to the Capitol. Okay, let me sit down. Okay. Because some of our jobs are going to be affected. And we might be in the room on the other side of the wall. So we don't want, do y'all want to be there? Well, I'm not going. So anyway, I really do think it's about relationship. Miss Bruce called me and she said, will you? And I was like, the room is yours. And that's why I'm here today. I work with most of the people in the room at some place. And if we don't work with you, we want to work with you. I thought Mr. Jackson comes here and do groups. And they're like, Mr. Jackson, stand up. Everybody probably know him.
Trio.
Trio. So Mr. Jackson was coming up the sidewalk into the building, and they said, Mr. Jackson's here. I said, this is not the day he comes. And I said, why are you here? He said, I'm here for 100 families. I said, come on in. So again, that's the collaboration.
Yeah.
We're going to have a surprise for you at about another 20 minutes, another collaboration. So we have finished. Go ahead.
I'll keep it brief. So I would just agree, just the collaboration, or just building relationships is key. And Ms. Bell hit on something there that I was going to mention, that with direct services, we're working with people indirectly, but when we also come together for advocacy work in this at the local, state, and federal level, our voice becomes very strong. Obviously, there's a lot of people in this room, but there's a lot more of us in this community across the state. So whatever issues, whether it's a bill or something that they're trying to put through for funding that is going to impact us and the people that we work with, if we could organize and like come together to, you know, do advocacy work, I think we could be more effective. I mean, if we're just working together on a higher level, so I would think that that would be another level that personally I think that we could do better at in the state of Arkansas, and now we have some room to grow there.
Can I say one more thing? We're not in competition.
Right.
Yeah.
There's no competition in this work that we're doing.
That's right.
So I think if we realize that we're not in competition, I know a lot of times when there are grants or something and we're all applying for the same thing, so be it. But we shouldn't be in competition.
That's good.
Amen. You said amen.
All right, so the next question, this is going to be specifically for Kevin and for Kyle, because I think you guys can probably speak. Well, all of you can, but I have other questions for the two of you. But what role does mental health and substance use treatment play in successful reintegration? Kyle, you want
So, as I mentioned earlier, that
Yeah.
the percentage of individuals who are incarcerated or going through the reentry process that have either a diagnosed mental health issue or a substance use disorder is high. So it really goes hand in hand. And so oftentimes if the substance use and the mental health is left untreated, that leads to behaviors which can lead to criminal activity, which could lead to poor relationships, which could lead to all the other things that happen that end someone back up being incarcerated. So, I think that when you provide an individual with the opportunity to receive treatment, whether that's in a clinical program, a faith-based program, a reentry program, wherever the program, a peer support program, whatever works for them, and they can address those core issues that may lead to substance use or their mental health kind of spiraling out of control. I believe we can reduce recidivism, reduce the amount of crime that's being committed. So I think it plays a key role. I also would say this, that one thing when it comes to reentry, the phrase ACC approved, and if someone in the room wants to correct me, please do. What I understand about ACC approved when it comes to treatment is that doesn't actually apply to treatment facilities. That applies to transitional living and sober living facilities. ACC approved for being licensed by the state is what you need to provide substance use treatment. ACC approved really just means for treatment, will your PO, or if there's a judge involved, allow you to go there. And oftentimes, particularly with like faith-based programs, there's many great ones across the state that maybe they won't, and then they let someone go and they see it successful. Well, then all of a sudden now this place is ACC approved. It's really it's just that PO is now comfortable with allowing clients to go there. And so I just think that's good for people to know, because we get that question a lot. Hey, are you ACC approved? And I'm like, that doesn't really apply to a treatment facility. We do work with the courts. We are licensed by the state. So that ACC approved terminology is specific for transitional living facilities.
Kevin?
I'm ACC, so I was going to say you are correct.
Thank you.
Kevin?
I think you hit it on the head. But not only that, again, like I said, looking at that client and knowing what they need. It's not always the person needs to go back to jail or anything like that. They need to go. They need treatment first. And what kind of treatment do they need? Are they ready to receive substance use treatment, right? Or do they need mental health first? Understanding where they fall at in the area, getting them screened, right? And so that's a big thing. Finding out where their client is, because sending somebody back to jail or anything like that, or prison, a lot of times we're not being effective. So we have to look at getting the person in treatment first and what it takes to get them there.
Thank you, Kevin. That's good. Ms. Bell, I know you have an answer, but I have a question later for you, okay? But I'm sorry.
No, go ahead.
Okay. Shanika, how do we ensure that job training and employment opportunities are accessible for individuals post-incarceration, since you deal with the employment side of the city?
Post-incarceration, initially, we changed a lot and tweaked a lot in the last few years with the City of Little Rock's reentry program. We make sure now post-incarceration, before they get out, that's really where it needs to start. We're trying to get it to where we go in and speak inside the prison so they can understand that they do have resources upon release. But we are listed now in several prisons with the IPO that when they give them resources, upon release, they know that they can come to the City of Little Rock's reentry program, and we provide several resources for them. So when they go see their parole officer within the 24 to 48 hours, the parole officers are now, Ms. Wolfalt, we got a chance to meet her, and she had us to come in and speak at the probation parole office about the resources that we offer. So we've been very successful, you know, honestly, with meeting people right where they are. You know, every person that comes in, their needs will be different. And we've been successful. I'm just gonna be completely honest. We touch bases with them to make sure that they're staying on the right track, because it's a holistic approach. You can't just throw them out there to a job and just say, oh, that's it, they have a job. No, they need more than that when they're getting home, so that's pretty much what we do.
And I saw that video too, you did a great job.
Thank you.
Speaking of probation.
Thank you.
Pastor Bell, do you want me to address you as pastor since you're my pastor, or Miss Bell? Deborah Bell. Oh, I can use Deborah Bell. I like that. Deborah Bell. How can community-based organizations better support families impacted by reentry?
Community-based organizations can better support families by reentry. As I think about that question, in particular here, because substance abuse is our area of expertise, we try to ensure that our clients, our customers, have time with their family. So the things that we do, we have Wednesday night family process time. So they don't just come and bring them woom-wooms, what you call them, snacks and
Zoom zooms and
Zoom-zooms. Anybody else know about that? That's snacks. They come to have time, and there's a counselor who can meet with them and the family in order to deal with those things that might have caused trauma for that particular client, and things that the family has experienced because. So there is a time really where family, children are very involved in treatment. One of the things I found out about one of our clients told us is the Wednesday night family process group was a trigger for him because he didn't have family.
All right.
He had been abandoned.
Wow.
Now, had he not shared that with us, we would have had him in a group that was a trigger. So again, we talk about learning and knowing the client and what affects them. We just knew that in family process group, he wouldn't speak, he wouldn't participate, or he'd leave the room, he'd come back when it's over, and so we had to have a discussion. So I think community-based organizations should definitely look at how do we reunite family. For some people, the family is the place where they did their thing. So we have to know that, and how do we address that? How do we work together with the family? How do we say, maybe you don't need to go back home. You and your mother used together. So there are things that we have to do as really as far as knowing the client. So we can't put everybody in the box. I think sometimes we do that. We have to look at all their needs.
I have one last question for the panel. I'm going to open it up for any questions from the Alliance. And this, anybody can answer, you can answer, or you don't have to, but how can the Alliance and its members play a greater role in reducing recidivism and promoting long-term stability? I'm talking about all the people in this room. This Alliance, how can...
I would say that what we're doing here, what 100 Families Restore Hope's doing with the alliances across the state, is they're doing a lot in the form of being able to provide a space for people to collaborate that are working with the same individual. I think that is tremendously helpful. One thing that I would encourage people to do is look at your entry point into whatever your program is, and think about if you were that person that's just getting released, doesn't have transportation, no financial support, little family support, little resources. Is it designed with that person in mind for them to get there easily? Or is it designed for the convenience of you and your staff members? And I'm not saying there's anything wrong with that. I'm just saying that our systems of care can sometimes be designed with not that person in mind, and it's expecting like a person to be, firing on all cylinders and have all the resources that we may have available to be able to just get there. If you have to go to this appointment to get approved to go to this appointment, it's hard enough to get to the one appointment, right? Like, so just thinking about our systems and how we, you know, the access and how easy it is for people to get into our programs and our services.
I like that. Thanks, Kyle. Continuum care and warm handoffs, right? We have detox, right? I need to get this client to Miss Bill or Kyle because our organization may not have that, except that insurance. Let me make a phone call. Referring is really important, right? So if I can't treat, I don't want to say, hey, okay, we don't treat that. We can't treat them. We can't take them, right? Making sure that you give them the next option.
Yeah.
I'm being honest. I probably place just as many other people in other treatment programs as we, you know, over that I do in natural state. So making sure you get that person the help that they need. I think a big thing also, far as substance abuse, people don't understand what catchment area means or what it, you know, how it works. Everybody says, okay, well, RCA is our catchment area here in Pulaski County, right? And they say, well, all the beds are full, but most of our clients that we service are homeless, right? They're in need of housing. So what catchment area do they really fall into? Can we not call around the state? Can we not send them to New Beginnings? Can we not send them to Mills? Yes, we can. Those options are out there. But a lot of times it's the education part that you know that people don't know. There's always somewhere for somebody to receive help, and we need to make sure that we refer and go the extra mile, even though our organization or our organization is not benefited from that. It's still about the client.
Good. Thank you, Kevin.
Okay, I just want to add that if you do this work daily, if you work in reentry or recovery, this is hard work. You know, I'm just gonna add, if you're not doing it from the heart and you just working hard, you won't succeed in this line. You have to work from the heart to help people, and everybody's not cut out to do this type of work.
Amen.
That's right.
Networking, make sure that you have, because that's what people are coming for. Being a justice impacted female myself, you know, sitting on both sides and knowing what it's like to be on that side, and I'm blessed to be on this side, you know, where I'm able to come in and assist people. If you're working only hard every day and you're not doing it from the heart, that's going to be the main thing that we have to do together as an alliance to ensure that everyone is successful on their reentry journeys.
Thank you, Shanita.
So, ditto. I will say this. I want to say something about promoting the long-term stability.
Okay.
30 days is nothing.
That's right.
Yeah.
Forget it. It is almost absolutely necessary, I think, from my experience in working in treatment for, I'm not gonna say how many years, but many, is I've seen long-term treatment work. And when I talk about long-term, I'm talking about, right, they might have a sponsor, you know, they go to meetings, but they're still connected to a faith perspective, and they're still going to a family group. So long-term treatment, and the unfortunate thing is, I don't know who came up with this 30-day thing. I mean, people think I do 30 days, I'm good. That's a lie. Isn't that a lie, y'all? Oh, okay, yeah, okay. The dog pound over there, you know. Roof, yeah. And so again, I think somehow, I don't know how. Unfortunately, I don't even know what the city does as far as long-term treatment. And that is the key. So somehow with the Alliance, I think the Alliance is great because you're bringing us together and we're talking together.
That's right.
And we know each other. You know, I know Dr. Odell, but I'm sorry, we hadn't even met. And that don't make sense. We're doing the same thing. So thank you for bringing us together. I think that is key, but reducing recidivism is going to be having long-term treatment. And that's not 30 days. When we were at the Hopehub, people say 3 and 4 years. They wasn't even trying to go. And they had money too, they were working. We had a bank within the center where they would get money orders and put their name on them and keep them. So whenever they got ready to leave, they had $3,000 or $4,000. They didn't leave there with nothing. But today, unfortunately, with not having enough resources to do that, it has caused a major issue for most people who are in recovery. So here we can provide, we have 30 single room apartments here on this property. We have 14 across the street for men. We have 4 up the street for women, and that's not even enough. We stay full. And unfortunately, the beauty of it is, and I'm finished after this, is when people move over there, they don't even want to leave. Because they're somewhere where they have found a new family, they found love, and they're afraid to leave, which I'm kind of glad, because that means they're not quite ready. So we don't push nobody out. People say you put me out, that's a lie. You put yourself out. Because you didn't pay rent or you didn't do something. And the last thing I will say for real is we take anybody. No money, no insurance, don't tell nobody else I said it is because of Reverend Robinson, our emeritus executive director. He just believed everybody deserves a chance.
That's right.
And so again, let's go to the Capitol and advocate for more resources.
So
Thank you.
remember, there are committees that you can join, and if you're interested, just see me. I can give you more information about that. We need to form committees within the alliance so that we can do more work together. All right, let's give our panelists a hand. Any questions? I know, Lavelle, would you like to ask your question now?
Yeah.
And then anybody else?
Yeah, kind of a statement / question. I'll try to be brief. My name is Lavelle Baltimore. I appreciate everybody on the panel. You guys hit a lot of different points that I kind of just have a little bit of conversation about. So true compassion, really having appreciation for what a formerly incarcerated person really deals with in their walk. I think that as an organization, and I have a nonprofit that's called Square One, and I formerly incarcerated and had like 8 more months on paper, and that's a very challenging walk. A very challenging walk. And when you, if you just talk about the market, you understand, and we look at what is a livable wage and what is quality of life. You understand when people are losing jobs, got jobs that are going overseas, education, when you look at technology and how that eliminates a lot of just regular people in the market, let alone getting to people like us in this group over here. So you wake up every day and you say, well, I don't have any skills. You understand, and where are those resources and opportunities in this alliance that puts those people in position to be able to compete after we've already been knocked down? You know, you talk about being in jail for 17 years. Well, back in the days, it may have been a negative thing, but they probably were selling dope, and they had a good living wage, and they were able to take care of their families. So fast forward when they come out and get on the streets today, you understand ChatGPT, Gemini, Cloud, all of those people are taking the general market's jobs. So what opportunity do we really have if we're not being able to be put in a position to succeed? As we talk about employment, how do you truly advocate for us? And advocation is, hey, that's again, I'm trying to put this person in position. I mean, do you go to the MAC form or do you just send an email?
So you're asking the.
You want me to speak on
Yeah,
that?
and you can speak on that, and I have one more thing. And emotionally, financially, and socially, that's what most of us deal with every day on some aspect, and that is a holistic house that we are trying to build as we continue to walk this path. And how do you guys, how do you really help, be successful outside of and I love the data, You understand, but what is that person, when you go to their household, how do they feel? You understand what communication and what does goals and success look like with the individual person, not the collective. And this is a collective here, but what does, and I don't know any of these people, but what does each individual, what does success look like? And so, and I appreciate it.
Okay, I'll answer the first question that you asked. Okay, you said you.
And thank you.
Oh, no problem. Thank you for asking it. First of all, before I get into this, thank you 100 Families Alliance for putting this platform together. Like I said, it's much needed. Thank you guys, and thank you for the invite, LaShawn. Okay, do we truly advocate, and what do we do? Okay, so what it looks like when a person comes to visit us. We do an intake form with them, let them, kind of give us what they're needing. Whether you need employment, whether you're needing housing, whether you need SNAP benefits, what do you need? So we can understand, because I don't know them, they don't know me. How can I help you to be successful? So once they get that, we look at it, we talk to them, we discuss their charges. Drug charges, a lot of companies don't look at drug charges. We can get them employed in our sleep, with drug charges. We go out, we tour facilities to make sure, we know what they're doing when they ask us, well, what will I be doing at this job? What shift will I be working? What's the times? What's the pay? We know all of that. Not only do we go out there and do it just to make sure we know what they'll be doing, I'm looking at how their interaction is. And what I mean by that is, are you going to still be talking to them like they're incarcerated? How do you treat them? I want to see how the treatment is. How do the employees network and just kind of react to the person that they're seeing? Your instincts become sharp when you do this work. You're able to spot the people that are serious, and you're able to spot the ones that are just not. They are sharp when you do this work. It's just honestly. So we go out, we network, we know what job. So some employees say, yes, I'm a second chance employer and I'm looking to hire second chance people. Right. Are you really second chance? Are you really second chance? Do you just want to hire people that had drug charges, or are you second chance and you're willing to hire a sex offender? Now, we have a few jobs that are definitely that. Do we go out there and advocate? Yes, we do. If they come into the program and they have open charges going on, but they've been successful in this program, we go to court with them. I'm going to sit beside you. Let's see what we can do to help you beat these charges. Give you a second chance if you truly want it. I had a young man on Valentine's Day. I went to court with him. He had, everybody knows that if you have a charge on the wire under the new system, it's 100%, 85%, 50%. Right. It's no 30 days, I'm gonna go sit down for 30 days, 6 months PV. There's none of that anymore. So he had it on the wire. Matter of fact, he had 2 charges on the wire. We went to court together. He's been excelling in the program. Everything that I've asked him to do, he's done it. Stacks of certificates, just everything. He wanted change. He's been in and out of prison since he was 17 years old. So he said, Ms. Shanika, I feel comfortable if you go to court with me. I said, I'll be there. I went to court with him. They were getting ready to sentence him to 10 years in prison. They already had the bailiff on the door. And if you ever been through the justice system, you know what that looked like when you see the bailiff on the door with them silver bracelets on them. You know what that means, okay? So we spoke about it. His mom was there. His family was there. We all got a chance to speak. And at the end, the judge said, I was getting ready to ruin your Valentine's today and send you back to prison. She said, you see my bailiff on the door. I already spotted it. I already knew what it was. She said, but today, I'm not going to send you back to prison. The City of Little Rock's reentry program took the time out of the day to come up here and talk about what So they went from a 10-year sentence to a 6-year suspended sentence. So you ask, do we advocate for them? Yes, sir, we do. 100%. If they really want it, and they're serious about reentry journey, their successful reentry journey, we with them 100%.
And I thank you. I'm familiar with definitely your work, and it was more of a statement, and it was more of a reinforcement that, again, I know the work that you and Mr. Dwight do. You understand, and I don't know how many people you guys are able to help, but that type of intentionality, you understand, if it can be enhanced throughout the whole process with the organization. I'm not saying that it don't. I'm kind of new here.
Yes, sir.
You understand, and I appreciate being here, but thank you.
And I appreciate your question. Thank you.
And so I want to add to that too. For the last probably 35 years, BCD Hooper Treatment Center, through Reverend Robinson, has been in court advocating for people daily. When he walk in the courtroom, whatever the judge is doing, she stops and tell Reverend Robinson to come up.
All right now.
All he'll have to say is, I'm here with her. She said, okay, let me sign the court order where she's going with you today. Again, that's because of a relationship. That's because of credibility. That's because we wasn't looking for the dollar. That's why we have a $5.4 million building, and I'm not bragging about the building, but I'm bragging about the credibility for advocating for people. And advocating goes beyond the courtroom. It goes in the community too. See, when the community starts speaking to you, letting you know that's a trap house, that's a drug house, because they don't want it in their community. So we have to start thinking about what can we do in the community? What is it we can create? What is it you can create as far as jobs? We got to start thinking about what we can do for ourselves, and not just depend on. I love advocating. Don't get me wrong, because I sometimes can get real rowdy. Sometimes people don't even want me in the room. I don't get invited to a lot of things. I'm telling you the truth, because I'm going to speak the truth. I have nothing to lose. They didn't hire me and they can't fire me. They can cut their dollars, but God got something from this place. He's made a promise. That's why we've been here 40 years. Not because of so again, I appreciate your question, brother. But let me say this to you. You need to be doing the same thing. You got experience. I'm not saying I'm gonna hire you. I can't. But again, it's gonna take my dog pound over there doing the same thing as well. I just think we gotta come together completely, even if we don't have a nonprofit or business. Because I'm gonna tell you one more thing that's happening. There is a system that's looking forward to shutting down small business like this one. Let me tell you, at least every year I get 4 or 5 letters from large hospitals from other states, treatment programs from other states who wants to buy the business. I had a board member once saying, why don't we sell? She is no longer on the board. We're not about selling. We will not sell our souls to the devil. So, okay, yeah, we never have a guest.
It's 10:05, it's 10:07. I know Kyle, I know you have to, you got something to say?
I just wanted to, as far as avocation, guys, also one of the biggest entities that we have and the biggest programs that we have here is the peer services that we have here. So we got Wolf Street, I see Monty and the CEO right here. A person can go work in peer services if they have 2 years of clean time. All right, so that automatically gives you a place to get back into getting a real professional job, right? And not only that, with peer services, these people have been where you, like you said, yourself and our client and the clients here have been. So the things that have worked for them, they're able to give those opportunities, that knowledge there to those clients, and for better success. It's here. We just you have to collaborate, you have to talk, you have to discuss. These people should know you.
Yes, go ahead, we have a question.
First of all, I want to, y'all forgive me for rolling in late. I have like 3 things going on at the same time. So
Stand up.
Okay.
I can't.
Okay, what's going on? Christy Eisen, I'm the founder and executive director of Food Jobs Work, and we are a culinary workforce training program for folks coming out of situations. About 90% of our folks are reentry, and they're my favorite work. And I wanted to speak on. Anyway, we're part of a national network called Palace Kitchen, and they do training with us on this very thing you're speaking to. That like all of our folks have been through trauma, especially if they've been incarcerated, if they've been, in whatever kind of situations. And you gotta consider that. Like I wonder if we as a group ought to do some training on that, like how it affects the brain, and how that affects their reactions to situations. And and then we have a thing in our we teach at Wolf Street. We had a little something happened yesterday. But
We made it.
we made it. Okay. But culinary is a great place for reentry folks to work because we don't care what your background was, as long as you show up and do a good job. And then we train you in our program to do even more. It's not just entry level, not just burger flipping. Like I've got graduates making, like one's about to hit 6 figures.
Yep.
Because she's running big orange midtown and has been offered some big stuff. So
Yes.
yeah. Anyway, that's what it
And
is.
she's on Hopehub.
Yeah, I'm on
We have a special guest, and if you need to leave, I understand, but,
You don't wanna leave.
you really don't wanna leave,
Don't leave now.
but since this is about reentry and we, are at a treatment center, we have a former Dallas Cowboy quarterback. Is that who he played for, right? Okay, go ahead. Not that I'm a football fan, especially a Cowboy fan.
All right, so let me say real quick, so we talk about connections and collaborations,
Yes,
right?
that's
We
right.
talk about relationships,
Same one.
confirmation that this was supposed to happen today. Okay, can you please just? So, last year, connection. Last year, connection. Last year, connection. I got a message from a friend. Okay, Casey Bright. I asked her, could I say the person's name? And they invited me to dinner. Now, guess what?
What?
When somebody invites you to dinner, they want something.
Yep. Hey, you want something? You want
And so, because we believe in listening and hearing and creating relationships, we had a chance to have dinner together. So I'm gonna let you introduce yourself and what you're doing down the road. Okay, go ahead.
I love being put on the spot. Hi everyone, good morning. I'm Abigail Stoll. I'm the owner of Cross Hope by Restora. We're a substance use and opioid use clinic in Pine Bluff, Arkansas. We opened up in July and we offer outpatient, nurse practitioner, medical, brain mapping, hepatitis C testing for our community. So really like the whole gamut of services. Quincy is our Director of Business Development, and he's here. We're having a grand reopening this morning. So he's going to give his story and tell a little bit about his journey.
Thank you.
Well, good morning. Like they said, I'm Quincy Carter, former Dallas Cowboy quarterback, and also for our Razorback fans, former Georgia Bulldog. But yeah, like Miss Deborah said, you know, I'm truly, I'm truly understanding when the spirit moves.
Yeah.
The spirit moves. So
Amen.
you know, we like Miss Abigail said, we're having our grand opening in Pine Bluff today. Our re-grand opening, Cross Hope by Restora. Casey, who couldn't be with us today, he's a little ill, so be praying for him. And Casey, you know, has spoke so highly of Miss Deborah, and we didn't actually know you guys would be here this morning. But what you represent is, you know, what where my life had took me, and the things that, you know, after the glory days of the Dallas Cowboys, and me, you know, making mistakes and putting drugs and alcohol in my life, you know, my life went down a whole nother road. And so I was that, you know, believe it or not, I was that former cowboy that, you know, was homeless after about 2 years. I say the end of '06. And the only reason I wasn't homeless all the way, well, I was homeless to a point, but I was still playing arena football. And so my talents was allowing me to go state to state, just living in an apartment. But as soon as that season ended, I was homeless, you know. So, so my heart is so sold out for helping people. I know my own personal struggles, but my, you know, my faith and where, you know, the book lies at, whether it's AA or NA, you know, God is all over that.
Amen.
And I found my relationship with God back through AA, and so I credit AA for that. You know, I like to still say young man, but I'm getting up there close to 50 now. But I'm a young man that, you know, I was born in near Chicago in Bloomington, Illinois, and came down to Georgia at about 3 or 4 years old with my mom. And, you know, it was humble beginnings for us, just me and mom off Custer Avenue and Moreland Avenue in East Atlanta. And so, so my upbringing, you know, was very humbling, and God gave me a lot of God-given talents to take those talents to the mountaintop. But you know, I like to say I abused God's, you know, I abused God's talents that He gave me, and I paid the ultimate price for it, and struggled, you know, in and out of rehabs for what, 2006 to like 2018, in and out of rehabs, like I told you about, traveling around for about 3 or 4 years, just trying to find arena football jobs and shacking up in apartments for a few months and going back home, not really having a good relationship with my mom, so there wasn't no home in Atlanta, and, you know, trying to find just any place to lay my head, and sometimes that place was in my car. The arrest, you know, I don't like to get into all the war stories because we all have them. But the arrest, the probation, the time spent in jail. A lot of people don't know this, but shoot, it's not a lot of time, but to me it was like about 10 years. But those 4 or 5 months I spent in jail straight because I kept violating probation. But that didn't even change. Changed me as far as my habits. But in 2019, I decided to put 2 feet in, and I decided to, you know, I had been going through the steps 1, 2, and 3. You know, you get out of rehab, you're supposed to, quote unquote, find that sponsor, get to that 4th step, start, you know, dealing with those resentments and fears. And I guess that's the easy part, you know, getting down to them resentments and telling everybody, or showing your sponsor what everybody done did to you. But I think where we stop at and where that road gets hard at is on that 4th column instead of 4. When it started talking about, okay, well, what part did you play in? Come on. And then that's when we go to ducking and hiding. And I did that for so many years. And like I said, in 2019, I got a sponsor that I don't like to name drop too much, but you probably know of him, Hollywood Henderson, who has been in my life since like 2007. And you know, it's one of those desperate calls again in the morning, and after a crazy night and just, you know, being in the thick of that addiction, and calling him and saying, hey man, I need some help again. And he told me, this is my last time trying to help. All right. And so he called a buddy of his, Marsha Stone at BRC, Bringing Real Change, and called her, and they were down at, because my addiction took me all the way down 10 minutes, you know, from the border, McAllen, Texas, Weslaco, Texas. Yeah, I was down deep in that thing. And they came and picked me up, and within 5 or 6 hours, And when I got to rehab, I didn't remember too much going up from the ride, because you know how we still got to get that last one in. But the most ignorant thing we could ever do. But that's us, huh? But yeah, I vowed when I got in those doors and woke up that next morning that I was going to do everything I could to get my life back straight and live a life of recovery, because I knew of it. I knew the way. But it had to be some work to be put in. And so I just decided that I was going to do that. Now, has that road been easy? Heck no. You know, even to this day, you know, it's so ironic. Last Sunday on Easter, I was supposed to speak, and I've been dealing with a situation with my son. I've got an 11-year-old, and his mom lives about an hour north from me. And it's been a little custody battle back and forth. He's been living with me for this school year, and then all of a sudden, about a month ago, it started early in the year with some back and forth things about him wanting to go home and things like that. And then that thing ramped up back up on me again about a month ago, and now Sunday I'm getting a call after I dropped him off on Friday. I'm getting a call that he's not even coming back with me, and not even gonna finish the school with me, because now he wants to go up north, and they got spring practices starting this week, and it's just like, wow. And it's a ego hitter, because you know, I've been blessed to really get back on my feet and be in kids' lives and have my own quarterback school, my own foundation, my camps, and so I'm working with so many different kids, and then to not have your own, you know. I mean, I've got 10, 11-year-olds, 12-year-olds calling me every day when we're working out, problems in their lives, you know, coaching high school football, and that really hit me. And, you know, I continue to pray, because I was actually on my way up to go speak that day. And I just continue to pray, and I just ask God to just, you know, hey, whatever I need to say, you know, when I get there, allow me the words, but then also, I mean, I've got the ultimate, you know, key to life now. I've got the tools. So there was a call with my, you know, sponsor. You know, ironically, we had just me and a couple of my mentors had just went to a big meeting in Atlanta that we have off Moreland Avenue, where I grew up at, which is so ironic. We went there Saturday. So I just went back to what I know, you know, and that's been able to carry me, you know. And through those times, God shows you, you know, that, listen, I got you. You're strong enough. You know, you can do this. And so it took me back to those early times in recovery where I knew I was broke before I came out of rehab. But my faith and my strength that I gained so much with going through these steps and listening and being able for the first time to really take direction from the people that has really, you know, done this, and really living a life of recovery. So I took myself back to those days. Well, God took myself back to those days. I can't even take credit for that. To show me those times where I'm getting out of rehab, I don't have a dime in my pocket. My way, when I was going in and out of rehab during those 12 years I was talking about earlier, my way of getting back into supplanting myself back into society was, you know, jumping back on social media and, you know, having workouts and stuff like that, because that's how, you know, I was, you know, making my money. But my sponsor was like, you know, I think what's happening is you're doing this, and then in your mind, you think you're back at that place that you were years ago. But that's not the way that's not your life. And so he made me, never forget, he made me work at a factory called Michelangelo's first. He said, you're not gonna work out no kids, you're not gonna do anything, and you're gonna, you know, really get entrenched in the AA, do the 90 and 90. you know, really start learning how to get a home group, make the coffee. Come on. Do the little things, put the chairs up.
Yeah.
You know, do the little things to entrench myself in a life of recovery. And that was life-changing for me. And then a few months later, but COVID hit. A few months later, he let me do some things with the kids and everything. But I just been able to benefit from really the work that Bill, Bob, and the Oxford group put together years ago, and it's been a masterpiece. And I like, once you get this and you know it, come on, there's no way you can even talk yourself into, okay, this doesn't work. All right. And when the pain gets deep, you go back to them tools. Just like this story I'm telling you about my son, as bad as it hurts, you go back to them tools, there's no way you're not gonna come out of this thing, all right, with some direction, some peace of mind, some wisdom. And I just dedicated my life. You know, it's not gonna be perfect. I'm not perfect, I'm still making mistakes, but I just dedicated my life to living a life of recovery. I thank God for AA, because like I said, you know, when I got to that step 3 and it talked about doing God's will and understanding that aspect and stop self-willing everything, I was able to really, really start getting entrenched with my relationship with God. And then I just let God be God.
I want to thank you so much for your sharing today. He's coming back to Hoover, sorry. But they have to be in Pine Bluff for the grand opening. And I don't want them to be late, because that way he might not come back again. And then I don't want y'all not to come back, because this is not our program, it's Shauna's. And she said that you all were supposed to end, so I'm gonna let her end. Thank you so much, and God bless you. And I look forward to us. You're special right here. All right, thank you.
All right, thank you so much, Queen. Thank you. And thank my Alliance. Give yourselves a round of applause for being here for our monthly Alliance meeting. We will have our next Alliance meeting. It's going to be on oral health, mental health, and physical health, and how that plays a role, how you all play a role in that for our families in the community. You will be getting more information about that. Thank you guys for staying through this panel for us. I think did I have another question? I had another question. Casey?
This is Doria. I'm a prosecutor, one of the
Yes.
prosecutors, and I work on the prevention and intervention piece as it relates to youth. And so, 100 Families being a 2-generation model and a family approach, a lot of the individuals that we're working with in re-entry already have created babies. They're already on a track to potentially struggle more whenever they get into middle and high school. And so I'm curious, with the re-entry and the holistic approach of all of that, do you have a good spinoff for the children in the homes that to get them the prevention intervention piece, so that they are not ones that we are having to work on re-entry with later? And if not, is that a gap that could be wrapped around and filled if that isn't in existence?
Okay, that's a great question. Okay, so a few years back, LaShawn, I know you probably remember this, we had an event for families of incarcerated parents. Because when you're doing time, your family's doing time too. If you have a supportive family, your children are doing time too. You know, when you have a supportive family. We don't have an exact model. You know, we get someone that comes in and they have children. 90% of the time, the children are acting out, because when the parents get back, you know, into their lives, they already have resentment towards their family, their parents. You know, they've had to stay with grandma, auntie. They've been in the system. You know, so they're angry when they, you know, get back into that. So we refer out, you know, because they need counseling. They need. You know, I'll just say this. We had an event 2 weeks ago, a reentry conference. we opened up with a Blameless Children segment. It had everybody in the room in tears because we let the children get up and explain their stories and talk about their stories and encourage each other, you know, of what they needed to do. And I think that's something that we need to focus more on, you know, and have more of that to help the children, you know, that are going through that. So that's something that we need to also work on. So thank you for asking that question. That's something that we'll probably bring up and see what we can implement on helping more of the children.
That's my friend Casey. Thank you. Do we have any more questions before we dismiss? And at the end, we will, yes, Monty?
What y'all do for self-care?
You mean me?
Both of y'all. I was going to ask all of them. See, that's something that, see, the thing that's just like you guys talk about, because I'm like the rest of y'all, I work in the field like I'm getting to 19 years, and self-care is powerful.
It is.
Because we don't talk about the work, that we do the work diligently, and it comes from the heart.
Yeah.
But what do you do for self-care? Many people in here probably need you, they do the same work too.
Well, I'm gonna tell you like this. I think a big thing is you have to have a heart to do the work. And going to work, being honest, is not like going to work for my every day. This is something I'm very passionate about. I actually enjoy this. Every day I get up, I get to help somebody. It's not like work at all. Now I do, you know, everybody has their thing they do, you know. You see some guys who play golf and all that. I play guitar. That's my outlet. It has put me in a lot of rooms with a lot of different people that probably I shouldn't even have ever met. You know, the governor and these different people. And I open up, you know, those conversations, those hard conversations. It's just, you know, it's like, okay, we know you worked in that. We heard you play guitar. That's it. But that's my spinoff. You have to find that thing that works for you. Each person's different. You know, some people like massage, some people like whatever. But you have to have that balance in life.
Oh, that's a good question. You know, we have I'm never really off, you know, because we have a reentry page on Facebook, City of Little Rock's Reentry. Make sure you guys follow. We post a lot of resources on that page. So we get a lot of inboxes due to posts that we made. My boss, I work with Dwight Pridge, and he gave me a vacation. Told me to go take a vacation. He did a few weeks ago because I'm never really off. But I do like to sneak to that nail shop sometimes. Just, you know, go get a massage, you know, because I did learn that sometimes you do have to give yourself a mental break, you know, because I get so engaged with my clients that I want them to be successful so bad, and I take it personal when they don't, and I had to do a breakdown with it to just realize that they have to want it too. Right. No matter how bad I want it, you have to want it. So yeah, I do try to make sure I squeeze self-care days in though. You know, what do you do, Mr. Monday, for self-care?
Well, you're going to get a lot of that information because I'm going to get with you and your buddy there. Okay. I'm a peer support supervisor at Wolf Street Foundation.
Yes, sir.
And peer support.
Yes,
it's
sir.
like my man gave me a plug.
Yes,
I appreciate you.
Yes, he did.
It's something that I want to get us involved with you guys with.
I have a therapist.
Oh. That's my old boss right there. That's my boss for my 2 years.
Yes, very transparent. I'm a pastor, I'm a mother, and I am a wife, Jesus. But therapy for me has been the thing. I like art. I do meditation.
You shop.
I do not.
Yes.
I have retail therapy too.
True.
But I do believe that I work with I'm in a partnership with a group of clergy women. As a matter of fact, next week we're going to a clergy woman's some time together. It's not a conference. To just be. Because we pour into people so much that we need to receive something back. But therapy.
So
I don't take medication, but I do have a therapist.
But next month our Lions meeting will be on families and how the community plays a part in mental health, oral health, physical health, all of that. So again, thank you guys so much for coming. That was great question. Shanika has something else to say. After that, then we're done, y'all. Y'all can network. Y'all can.
We're done. Thank you guys for coming. Thank you.
Thank y'all so much. Let's send that forward.